Hey, Dr. Barnes, I'm going to be handing this patient over to you. His name is Hunter Johnson. He's 25, and his only known allergies are eggs and milk, so he's not allergic to any medication, and you don't have to worry about latex allergy or anything like that. He came in a couple hours ago to the ER because he was experiencing severe pain in his low back and in his abdomen. He described it as excruciating and sharp pains if he would move too quickly or even if he would really move at all. And the pain comes in waves, and it also alternates in intensity. He's also had dysuria and hematuria for the past 5 hours. So we need to watch him whenever he does go to the bathroom to urinate and relieve himself. As for the physical exam, there's no external wounds, but he is tender when you palpitate around the low back section where those kidneys are. As for his vital signs, his temperature was normal, 98.6. His pulse was fine. Well, it was a little high. It was 95, but that's because he was in pain. And then blood pressure was 130/85. He's 5'11 and 165, so very healthy individual. As for his general appearance, he was healthy, but he's in very acute pain right now, so we got him on some pain medication to bring that down. I believe that his low back pain and all these episodes are due to nephrolithiasis in both of his kidneys, and the reason I think that is because we did 2 exams. We did a nephrosonography, and we also did a urinalysis on his urine, and the nephrosonography found 2 kidney stones in the left kidney and 1 kidney stone in the right kidney. The 2 in the left kidney were 10 millimeters, so there is a very small chance that he would be able to pass those on his own. But in the right kidney, the 1 kidney stone was only 5 millimeters, so he should be able to pass that by himself. So I sent the urine sample to the urologist, and he came back and said that there was blood in the patient's urine, which is just from the irritation of the kidney stones. As for the treatment plan, I want to send him to a nephrologist and have the nephrologist perform a extracorporeal shockwave lithotripsy, or ESWL if you want to use the acronym, to break up the stones in that left kidney. And I also plan on keeping the patient overnight just so that we can use proper pain management techniques for him as he passes these stones. And obviously he'll need to drink a lot of water and make sure to pee in a specimen container and strain it so that we can do testing on his kidney stones and see what his kidney stones are made of so that we can get a better get him on some medication that will reduce his risk for kidney stones in the future. So as for the diagnosis, obviously the patient is experiencing nephrolithiasis in both kidneys. And as I said, he'll need that lithotripsy from the neurologist. And once those are broken up, then hopefully he'll be able to pass those naturally through his ureters and down out through into the bladder and then through the urethra. So my recommendation is that the patient is discharged late afternoon tomorrow, but that'll be after he does follow-up instructions with Dr. Mayberry. Other than that, if you have any questions, then you can contact me on my pager, and I'm going to turn them over to you. Thanks.